I would like to highlight this importance of evaluating the adoption of standard of care in the community practice and also in academic practices in oncology. So in that context, we pursued this study evaluating the treatment patterns in the frontline space of advanced urothelial cancer. And we asked specialty of oncology nurses and attending oncologists to tell us what their preferred strategy in the frontline setting is. And we asked them two specific options. One of them, the standard of care that was emanated from the JAVELIN Bladder 100 trial that includes platinum-based chemotherapy followed by switch maintenance Avelumab immunotherapy in patients who achieve response or stable disease to chemo. Or the second option of treatment was concurrent chemoimmunotherapy, as was evaluated in the Keynote 361 or in Vigor 130 trials. And on that note, I would like to point out that based on those three trials, the standard of care with level 1 evidence that has resulted in the guidelines change is actually platinum-based chemotherapy by itself, gemcitabine or gemcarbo, for example, followed by switch maintenance Avelumab in patients with response or stable disease, based on the JAVELIN Bladder 100 trial. So we asked this question to these specialists, oncology specialists, nurses, and physicians, and the majority of those answered that they implement the standard of care, which is chemotherapy alone, followed by switch maintenance in those with clinical benefit. And we also asked questions: what are the factors that can influence decisions? And the specialists answered that overall survival benefit is important. Obviously, the patient profile and protoplasm is important. Quality of life, as well as side effect profile. All of those factors can influence their clinical practice. It was a small sample size, and this was interviews that were performed by phone. So definitely, this is, I think, important in the context of understanding treatment patterns and also understanding what barriers may exist in the adoption of standard of care, and also the ongoing need for education of the providers, including ourselves and other colleagues in the community, as well as the patients, in order to understand better, again, all the different parameters that are being considered when the treatment selection takes place. So this qualitative assessment, I think it's a step in the right direction of understanding real-world practice treatment patterns in the frontline setting, and actually, I think, reinforced that the standard of care based on the JAVELIN Bladder 100 trial is being implemented in most patients.